a peer-reviewed paper published in one of the leading journals. Anybody who wants to advocate this vaccine for the child who is not of an age to give informed consent, the parents, all parents who intend to give this vaccine for the child, so read the paper. I will just read out the title of the paper. Will HPV vaccine prevent cervical cancer? This is the title of the paper. Will HPV vaccine prevent cervical cancer? This has been published in Journal of Royal Society of Medicine, 21st January 2020 by Clara P. Rees. Author surname is R-E-E-S. Rees et al. Volume 113, issue number 2. So this very clearly, it brings out, this paper has been published without any pharmaceutical sponsors, without any conflict of interest. This paper has been published in a journal which has asked certain questions, and it concludes that there is no firm evidence because there are 100 serotypes and vaccine is only against 2 serotypes. So we do not know whether other serotypes will proliferate. And secondly, it says that the cancer screening has to continue. And there have been studies which shows that if cancer screening is in place for women over 40 years or 35 years, yearly cancer screening with pap smear, vaccine does not give any extra protection. There is no evidence to say that vaccine will give some extra protection against cervical cancer. So this paper is written in a very simple language with good evidence and in a high impact factor journal. So they should, in fact, I have got a number of gynecologist friends, and among those gynecologist friends, some have even circulated this paper to the cancer specialist, of gynecology cancer specialist. Earlier when I discussed with them, they were very, very convinced. In fact, one of them gave a TV interview also advocating HPV vaccine. He's a good friend of mine. When I sent him this paper and my commentary on the paper, I asked him to read that. So he was convinced that there is no enough evidence, and he said that yes, it should not be included in the universal immunization program. It can be kept for those who want to use it on a voluntary basis, and the taxpayers' money should not be invested in it, which should be better invested in screening for cancer, because there is no full protection. Because when you are investing a large amount of money in any program, you have to see the cost benefit, and of course the long-term harms and risks are also not known. In fact, there have been number of lawsuits against this Gardasil vaccine or HPV vaccine are going on in the United States. So there have been some adverse events reported, and the benefit is uncertain. So this is all, we have to make an informed decision. We cannot blindly, because clinicians and even my gynecologist friend with whom I interacted before I circulated this paper and discussed it, all of them were very convinced that it is a good thing, because it is good if there is a vaccine which can prevent cancer, but the evidence has to be very strong for mass investment, or a large-scale investment of money and resources, and neglecting the other protective measures like safe sex, like genital hygiene, and like screening at a certain age. So that this all I have to say. So the decision has to be informed, and